And I'm going to be honest, that was just the beginning. You know, it's important to take time and pause and reflect on things, as we don't pause long enough to acknowledge when something has happened and you've really accomplished something dramatic.
We engaged in this massive conversation with 10,000 people. So we're collecting lots of data from 10,000 people.
What we found out of that was that the interest was overwhelming. And in the background of that was them knowing that they're going to contribute something to the community and hopefully the world.
We're now ready to add 40,000 more Northern Nevadans to join us. And thanks to the personal genomics company Helix, our research teams will receive 100 times more genetic data than in our pilot phase.
We originally had the book, and now we have the whole library, and we can look for things that we couldn't see with the other set.
It's a huge deal. I mean, and there are very few projects in the world actually going on that are at this scale. So the opportunity to have novel discovery, to create better risk prediction is just, I mean, frankly, it's inspiring. I mean, I think it really is going to change how we think about health.
Right now in Northern Nevada, we've recently started a project where we took data from the original 10,000 people, so the 10,000 people we're already working on, and we created a risk model looking at the genetic risk of those people, and we've started recruiting those people to try and get them in to see us as quickly as possible and find out if they're truly at higher risk for having a heart attack.
We see these patients when it's already happened. That's a difficult problem. And you know, there's not a day that goes by in my clinic where someone asks, Dr. G, is there anything we could have done beforehand? Is there anything I could do for my family, my children? So this is real exciting. It's going to allow us to look into pretty much every cancer we want, any cancer we want, using our data team to make those connections to mimic what we're seeing here, and then start that screening earlier and hopefully prevent some tragedy.
Air pollution in the world is the #1 leading cause of early death. The team looked at what happens in the hospital if we start comparing these really short-term impacts. So we're not talking about long-term exposure to air pollution in large cities like Beijing. What you find is for a variety of diseases, whether it's sinusitis, atrial fibrillation, asthma, bronchitis, COPD, before one of these events, you have a certain amount of healthcare utilization from respiratory disease. After, you can have up to a doubling because of that. So really quick impact on health and wellness at the individual level.